Hi, this is Meghan McGovern again, and we are back together. We have a group together who've all had procedures done, and just kind of chat about it and talk about our experiences.
I was listening in on Mike and Robin, and I have to say that he mentioned that he told two close friends. I told everyone in my Rotary Club. So I figured they would know about it anyways. But I think in my case, it's now I'm probably about 6 weeks out, and some longer duration, yeah. And I can definitely see some amazing differences, and has really, in my case, this down here was what really bugged me the most. And you know, Mike, you mentioned that it was a opportunity for you to kind of feel younger.
Yeah.
And you do. You look at yourself and you look healthier. You feel healthier.
I think it's more healthier than looking younger. And you and I had talked about that a little bit. And when you feel healthier, and you know when you look in the mirror and you see yourself looking healthier, you're more confident. I mean, just walking around every day in the store or wherever you are. And you talked about that a little bit, how just healthier is confidence, and it feels great.
Yeah.
Well, I'm not as patient as you guys, so I wanted to go for the instant gratification. In fact, I think I was joking with Dr. McGovern that I'm an instant gratification queen.
And you look great, by the way.
Oh, thank you, Mike. Well, you know, unlike you, I didn't even tell my husband I was having it done. And he was on a business trip. He has a lot of business travel. So he got back 9 days after I'd had my treatments, and he was like, "Wow, you look hot, rude." I will draw a discreet veil over the rest of the evening. But I mean, I went to see Dr. McGovern, and I said, "Okay, I'd like some fillers," and we talked about the most natural ones, which were good for me, which were Juvitan. That's right, we chose, didn't we? And one of the things I like is we really talked about where to put it, because when I had them back in London in the past with other doctors, they said, "Oh, I'll just do a little bit here, a little bit there," and it was almost as though it was like, "Oh, I'll give her a number 6, you know, and I'll just put a little bit there." But you really looked at the sculpture of my face and where I needed it, and it wouldn't have occurred to me that we put a lot high up. Well, you, sorry, I felt like it was a team.
It's a team effort.
And it lifted it, and it didn't hurt at all. And you were just amazing. You just went in and did it, and it was like an artist, I have to say. And I was so pleased, and I am. And I just feel, I don't feel 46 inside. I feel sort of 32. And I just feel more attractive.
You look 27.
That's good. That's very good, Dave. Very cute. But I just want to look how I feel. And I feel, I'm never going to be a supermodel, I know that. But I want to feel a more attractive and younger version of how I was looking. And that just gives me so much confidence in my business life, in my personal life, and you know, it just makes me happier when I look in the mirror and do my lipstick, because I'm not trying to fill in, you know, all the creases and everything. So I'm just thrilled, and I know it will very slowly wear off, and at that point I may go for an Ulcera, or I may just, I'm so happy with these fillers. And the thing is, you know, you might say next time we talk about, well, actually I'm going to top up here now, or whatever you feel.
We'll put it where it belongs, yeah.
Yeah, I just feel a better version of myself, and it didn't hurt, and it was, you know, I'm just really glad. As I said to you, I'm really glad I found you in Savannah. We talked about some of the mild rosacea I have. Meghan recommended Levulan, which is the blue, I had heard of it as the blue light box treatment. So I went in a few days later and had that treatment. And I mean, you just sit around, and then you have the intense light. And I feel that's really helped the coloration of my face. I probably will have another, because I had one and it made a difference, but I think I may do a follow-up. Unlike the fillers, that was a couple of days of downtime.
And that's the indication that you really need more of it. The downtime with that Levulan treatment is because you have sun damage in your skin.
Okay.
There are two separate benefits that you're getting from it. We're treating the rosacea and getting the inflammation down, but we're treating that sun damage. So the more you react to it, the more you need another one.
Oh, really?
So I had another treatment myself 2 weeks ago, and I need more,
Really?
unfortunately.
How many have you had, if you don't mind me asking?
Over over about 6 years, I've had 6 treatments at
okay.
very irregular intervals. I did several treatments to begin with, and
Yeah.
then I typically will do a treatment about every year to year and a half. But obviously, in the last year to year and a half, I have collected some more damage because I had a pretty strong reaction this time. So
Oh.
I'll be doing another one probably about the same time you do.
Yeah. When do you think I should follow up? Because I had that one now I had the fillers about 6 weeks ago, 5.5 weeks, and then I followed quite quickly with the light treatment a few days later because there was no reason not to.
Okay.
How long do you think I should leave it? Have another any time now, really?
Yes, ideally, the closest we would do them together is 3 weeks apart. So
Okay.
anytime after 3 weeks,
so I'm
go for
good
it.
to go. But I did have 2 days when I was either hiding at home or channeling my Jackie Kennedy on the Onassis yacht look. And my daughter-in-law looked at me and said, because I love the sun normally and I'm out there and it was a beautiful day, but I listened to instructions, because I'm a woman, I didn't say that, and I kept out of the sun for 2 days, and I had this big hat and shades on, and she said, okay, what are you up to? And I took them off, and I was a bit slow, she said, what did you do? and then after a couple of days I just looked a little bit sort of swollen, as though someone had punched me. But after 5 or 6 days, you know, really it was great, and it was well worth the small amount of downtime.
Do many men have fillers done? And
More and more. I have a lot of husband and wife teams. Like the wife will come in first generally and get a comfort level, and then the husband will kind of come with her to watch what's going on, and then they'll kind of tiptoe in and do a little bit more. So I have many husband and wife teams at this point that we're doing a little bit of both. And the goal is to put it where it belongs. One of the fears that a lot of men have coming in is that I'm going to make them look like the women that I take care of. But what we're really doing is looking at your face and seeing where it belongs so that you look like you used to look. So it's not going to make you look feminine, it's going to make you look like you, but where you used to have volume in your face. So the goal is very personalized, like you were talking about before.
we were talking earlier, and the thing about the pain and how to deal with it. And for me, I'm not into Zen and all that stuff, but I took the position like going to the dentist, that I just had to kind of zero out my feelings and try to, focus on it and try to deal with it. And for me, being able to do that really made this experience not real painful. And but it'd be not truthful to say it doesn't hurt at all. There is some pain with it, but like that expression, no pain, no gain.
Well, I mean, you helped me out when I went, because I heard that you took a break and found your spot. So I knew that going in, and I didn't have anesthesia or any of the things to help it, but I knew that going in. And Robin,
Oh, he did. He truly didn't even flinch, didn't move a muscle, and I was like, "Babe, can you feel this?"
she wanted to make sure it was still working,
Yeah.
but I did.
Good job.
But I did, because
He was
of
like, "There's
talking
no
to you
way,"
first,
but-
I just found my focus and worked.
It's amazing how that works for men. I'm going to do better than that other guy. I'm not going to move at all.
I was thinking just the same thing.
That's right.
But you, sorry.
I wasn't trying to
I know,
confuse
well,
him. I
yeah,
just
I know.
gained from that knowledge.
If you're jumping around and going, ooh, give me 5 minutes or whatever, it's going to take longer. Just try to get in, get out, and the professionals providing this treatment really know what they're doing, and they're cognizant of what you're feeling, and don't push too hard. But it's really an experience that I don't regret by any stretch of the imagination. It was fantastic.
I've heard about Meghan, though, that she's, from you and others, that she's a true artist,
Oh,
or
wow.
actually really puts a lot of effort into what's going to make you the best you can be,
Yep.
versus some other doctor that says, 6
Right.
milliliters or whatever it is, here, and there, and you're done. I think you put a lot of effort into it and try to figure out what's best for them and what their goals are.
That's part of what brings me joy in doing this, is really creating what
right.
you are looking for and what you are looking for, and getting you what you're looking for.
I was telling a friend, going to Dr. McGovern was like having my wedding gown made for me, rather than just getting
That's
one off the
right.
shelf
Absolutely.
at some discount store.
Yep.
That's
Absolutely.
How I
Nice
felt.
metaphor.
Yep, absolutely. And that's exactly what I tell people whenever I'm talking with them too. I talk to a lot of people that maybe haven't seen Dr. McGovern yet are there for a facial or for some other treatment, and they're interested in things, you know, they bring it up, they're a little curious, and I say, you know, first of all, she's a woman, and she knows how we feel as women whenever I'm talking with a woman, and she's successful because she has passion for it. She really, and I think you do, I think that's why you're so successful at it, is women feel comfortable with you, they feel like you're taking the time to really find out what we want personally.
I would agree, and I mean, when I was talking to a friend who's very interested in coming to see you, and I said, well, okay, what would you say as an American? She just gets it, you know,
That's
she
right.
just gets it.
That's
There's
right.
a sort of instinctive understanding and the empathy, and I think part of that is being a woman. I'm very comfortable going to see another woman. That's just me, and I think a lot of women feel that way. And you just seem to have obviously you've trained, you've studied, you've practiced for years, but I think there is something innate in you, like with an artist, that you just see it.
That's
and then
right.
you have all the skills and training to do that. But I think for you have that gift of seeing it, and then you have the skill to make it come true. So
Yep.
I just would recommend you to anybody, man, woman.
I agree.
Yeah, I would like to add to that, that to me, what makes Dr. McGovern special is the fact that although her formal training and discipline is the use of a scalpel to help people with their bodies in all areas, yet as a physician and a surgeon, that's her training and expertise, and yet she can look at other alternatives that don't involve that expertise, don't require a scalpel, and recognizes that some of those can give equal or even better results and with less side effects, less downtime, less expense. And that to me is pretty impressive. I would guess that's kind of unique in your profession. You know, you watch the movies, the TV shows about plastic surgery and all that.
They're not
and-
all like the ones on
Yeah,
TV.
they're not
Thank
all like
goodness.
that. But I think it's really important for people to understand that, and I know your book that you're working on is going to deal with that, and that's really pretty exciting. I think it gives people alternatives that they're just not aware are so significant, you know, and beneficial. And I think that's
Because
really
it
great.
gives me comfort too, knowing, I don't know why, but I think that a normal doctor wants to jump to the scalpel. I get none of that.
Right.
From.
Well, I can vouch for the fact that she's a very good surgeon, but I think that your compassion too towards the fact that everyone doesn't want to have surgery, and that for many different reasons, you know, affordability, you know, and just that might not be their thing. And I think that your compassion for that, and then the fact that you are so tremendously talented at, as Leslie said, just you get it. You can look at somebody and say, okay, I mean, I know that when I sit down with you for filler or for whatever, I'm just comfortable with just whatever you think you need to do, just do it. You know, I don't even feel like I need to give you input, even though you want
Even though
my
I demand
input.
it,
Yes,
yes.
even though you want my
Well,
input.
right.
I
What do you want?
would really just like to sit there and say, well, just do what you think you need to do, because you do get it, and you do. I think you do have a great eye for seeing what needs to be
Potential,
done.
what potential is.
Yeah,
But
yeah.
I mean, in terms of the surgery, I'm not saying I will never have surgery, because if I felt I needed it, and that might be something that you need to go under surgery for, something in the body, you know, if I felt I needed that at some point, or if I got to an age or a stage, there was something that Dr. McGovern said, look, we can do a lot with non-invasive, we can do a lot with fillers, we can do a lot with the various light treatments, as I call them in my non-technical way, but actually at this point, maybe a small, you know, something around the eyes or whatever would be good. I would trust you to do that, and if I needed surgery, or I had a friend or someone that wanted surgery, body or face, I would say see Dr. McGovern, just because of working with you. But for now, I'm happy not to have a knife, but that's just me.
Well,
Right.
it's interesting because I think that a woman's perspective on this is probably more likely to have surgery than a guy. And I can just speak for myself that in this particular situation, I probably, if I could have gotten the same results through surgery, I probably wouldn't have done it.
I wouldn't have, I know I would not.
And now I have more confidence, and I can see the end result of how it affected me personally.
Right.
That then, the idea of surgery, if it ever came up, I think I'd be more open to it. So, would you agree with that?
Absolutely. I would have never have, you know, somebody says, you know, you're gonna go get some surgery and get a, you know, a facelift or whatever. I never done that. But I understand what you're talking about with now that you can see or feel the improvement it had. If surgery did the same thing, would I second guess that now? Maybe.
Yeah.
Don't you
Right.
think a lot of that, though, is about finding someone that you trust? And I'm not trying to minimize what you do. I know you're a doctor, but bear with me while I have one of my analogies. For me, I have a thing about my hair. It goes frizzy. Short hair is harder to cut than long hair. And I had a great person in London, so getting a new hairdresser for me was quite traumatic. Call me vain. And I found someone in Savannah I'm really pleased with, and you know, and I'm relaxed about that. So if she suggests something, or I say, well, actually, do you think maybe I should have some extra highlights, or we should, you know, do such and such? I'll trust her to do it. Now that's a very minor skill compared to what you do, so please don't feel insulted. But similarly, having found someone you're comfortable with and having had a good experience, so you've not had surgical experiences, now it would be sort of like, okay, well, I trust you to cut my hair, now you can do highlights and a tone for freestyle at a much higher level. It's the same principle. If you find the right person that you trust, then the world is yours, you know, and you'll move on, but you have to get to that level first. That's just my view anyway, and that's how I feel.
Trust is
as a
big.
woman.
Trust is big.
It's huge.
My job is to help you learn the options and try to get inside your head and find what's going to make you the happiest. And for some people, it's a little bit of everything, and for some people, their budget or their comfort level is tiny little bits of, you know, little tiptoeing kind of stuff. And for some people, they want to do everything that we can do and keep them looking like a human being, keep them looking like themselves. So it's really, people will choose different things, and it's really important to me for people to be involved in the discussion and not just say, well, find something and do it. Everybody has something that draws their eye in the mirror, something that really bugs them, and I can address every other thing, but if it's not the thing that draws their eye when they look in the mirror, then I haven't really done what's going to make them happy. So it's really important for people to be involved in that process, and I hand them a mirror and say, let's look together and figure out what's bugging you, and then let's talk about what are the best ways of fixing that and you know, anything else that we want to talk about.
Well, that's interesting. I just wondered, do you have a preference? If people come in and say, let's look at it together, or they come in and say, I want fillers, or does it not?
Well, I
really
like
matter?
fillers, so I don't have a problem with someone saying I want fillers. But there's a lot of education. I don't, some people are like, I hate these lines, put a whole bunch of filler there. And if the lines are there because of volume changes that have happened somewhere else, if I put a bunch of filler there, then I'm going to make them look like a bulldog. I'm going to make them look very bottom heavy, and that's not what we want to accomplish.
Like you put them in there for me to lift
and
up
it's
here,
lifting
because
it
you were
all
telling
back
me
up,
about the
right.
structure of the face
Right.
and how it builds up and everything. And I understood exactly what you were doing and why you were doing it.
Some people love that education process, and some people really think that they know what they want, and I want people to really get what they're looking for and look their personal best, and I don't want to do something that isn't going to give them what they're really looking for. So for some people, it's more challenging to get that education across, and we have to tiptoe and kind of get there gradually over time. I love people who come in and say, I am your palette, do what you will. It's fabulous.
Contact Dr. Meghan McGovern at Coastal Empire Plastic Surgery today to learn more.